why atropine worsens, but I think I should check and I'll let you know later. So that is about all this. And anything else about the harder drugs? I think that is about the antimuscarinic drugs. I'll just show it one more brief way. Okay, yeah, so scopolamine is useful in motion sickness, so that is important. Tripradormium and tiotropium we give it for COPD and asthma, so that is there. And solifenacin, all these things are for urinary retention. Benztropine and trihexyphenidyl. See, yeah, this one is very important. Benztropine and trihexyphenidyl, what is they used in treatment of drug-induced Parkinsonism. So yeah, they are anticholinergics, centrally acting anticholinergics or antimuscarinics, which are useful in drug-induced. In Parkinsonism, ACH will be more, right? So to reduce that, we give benzhexol, benztropine, trihexyphenidyl. So that is also very important. So that is there. And what is the cholinergic side effects? That is ABCDs: agitation, blurring of vision, constipation, confusion, dry mouth, stasis of urine, and sweating. Okay, next is ganglionic blockers. So ganglionic blockers, we have nicotine. So nicotine, nicotine is actually an NMDA receptor. Analog, agonist, but nicotine is also an functional antagonist of the ACH, cholinergic. So what it will cause, nicotine, what does nicotine do? Nicotine will increase the dopamine, it will increase the norepinephrine and serotonin. So what happens is, because if it's increasing the dopamine, you'll have pleasure, motivation. If norepinephrine increases, alertness, concentration, energy. Serotonin increases, you'll have memory, obsession, and compulsion. Memory will be increased. All these things can worsen. It can worsen the attention, it can worsen the appetite and sex function, it can worsen the anxiety, the mood. Generally, it can worsen. So nicotinic block, it can also cause convulsions, which will lead to respiratory paralysis. First, it will cause convulsions, and then it will cause respiratory paralysis. Initially, again, these can cause heart rate, BP and heart rate will increase, and then it will decrease. It can also cause vomiting. It can also cause mood disorders. Okay, and then the neuromuscular blockers, which is depolarizing and non-depolarizing, which we will study in anesthesia. The non-depolarizing agents are they block the the mechanism we do it in anesthesia. So non-depolarizing agents, it's only given as IV because it's not absorbed orally. It's useful in intubation, it's useful in neuromuscular paralysis and everything. So what are the drugs? We have cis, atra, pan, rocuronium, becuronium, atracuronium, all these drugs which will cause muscle paralysis and will also cause decrease in BP. That is always about this. Depolarizing agents which will cause acetylcholine esterase will be inhibited. So succinylcholine. So succinylcholine is being metabolized by the pseudo acetylcholine esterase. So how do we adverse effects of succinylcholine is there will be more of apnea, there's more of hyperkalemia, so it can cause arrhythmias and it can cause malignant thermia and it can cause hypothermia. So these are all the side effects of succinylcholine. All these things will be in detail in anesthesia.